All right, welcome to episode 4 of So What Do You Do? I created this podcast as a way to give out free and public information to college students, professionals looking to make a career shift, and upper management wanting to learn more about early career professionals and their experience in their industries thus far. Today we have my fourth guest, one of the most compassionate people I know, and my dear friend, Brianna Mercado. Brianna, how are you today?
I'm good, Kieran. How are you? Thanks for
I'm
having me.
Of course, yeah. Thank you so much for your time. I know you're extremely busy. I know you're saying you got work tomorrow, and we'll get into all of that. But my first question for you, and this is the question I have for all my guests, is so what do you do?
So, I am a registered nurse, but specifically, I specialize in pediatric oncology. So, I work with kids with cancer.
So, how did you first discover this field?
So, when I was 16, I volunteered at a hospital as like what they would call back then a candy striper. So, I was basically following nurses and tending to the front desk and really getting a good gauge on what healthcare looks like and what being a healthcare provider is. And after following a nurse, I fell in love with what they do. And I said, yep, that's exactly what I'm going to do when I'm older.
And how did you find the hospital that you started to volunteer at?
So I volunteered at a local hospital in Sacramento called Mercy General Hospital in East Sacramento. And I initially had told my mom that I had interest in volunteering at a hospital. And so what her and I did is we Googled volunteer positions that allowed people under the age of 18 to volunteer. And there's a myriad of options in terms of what you can do as a volunteer. But this specific position, as like I said, a candy striper, was the best thing I could have done to expose me to nursing.
Wow, I actually didn't know that. Did you have family in nursing or in the medical field at all?
The craziest thing is that I am the only nurse in my family. Mhm. Yep. I do have an aunt that's a nurse, but she does more aesthetics, so a very different specialty.
Did you have a good experience with a nurse or like a good experience with like a medical professional that made you want to go and volunteer at that hospital or look up volunteering in general, or was it just something where you're like, I just want to try this out?
I think it's two things. First thing is it's very hard to be a volunteer at hospital because you have to do a series of background checks, health panel, like there's a lot of steps. Having said that, I was willing to do that to get to this position. And what led me to wanting to volunteer as a candy striper was specifically because the nurses at this specific institution were so compassionate, so hardworking, and really good at having time management skills. And those are all of the traits that I obtain and I knew that I can use for the better good as a nurse. And there was one specific nurse that I remember. She was dealing with an elderly man who did have a history of elderly abuse and literally just put her heart out and did everything that she could, not only medically, but empathetically. And it just really drew me to nursing.
So, can you walk us through your background education and how you ended up getting to where you are today? Obviously, you started as the candy striper, but then what did you study, and then how did that lead to what you do now in your role?
Definitely. So, in order to become a registered nurse, you have to go through a 4-year Bachelor of Science in Nursing program. They do offer associate's degrees, but there's been a lot of transitioning within nursing when it comes to a registered nurse license up to advanced practice nursing license, that they want someone to pursue a more advanced degree. Having said that, my process is I attended a 4-year university and got my Bachelor of Science in Nursing at the University of San Francisco. And there's several schools that offer this nursing program. However, USF specifically was a direct entry program. So once I got into the institution, I immediately got into the nursing program, which I thought was phenomenal. And looking into nursing schools, I looked at what area, specific city, had the best hospitals. And no place has better hospitals. obviously subjectively speaking, then San Francisco. So we have USF, UCSF, we have Stanford and Lucille Packard, and a ton of Kaisers and Sutters. So with that information, it was an easy decision for me to attend this school. And in terms of education, we had to take biology, chemistry, anatomy, physiology, and a lot of prerequisite courses. And then once you pass those, then you would enter your clinical practicum and specific nursing courses.
Let's talk about the prerequisite science courses. Do you feel like that's applicable to your role in nursing, or was it sort of after you got through those like prerequisite courses and you started to take those specific courses oriented around nursing? Like, what do you feel like was more applicable to your job now? Like, what kind of education do you use?
I feel like that is definitely a hard question because the prerequisites are useful in a sense that here I am trying to pursue an advanced practice degree as a nurse practitioner, and I'm taking courses that I took as a prerequisite for nursing, obviously in a more advanced way, but I always utilize those prerequisite courses. But I have to say, what helped me throughout my nursing school and what helped me be the best nurse was the clinicals. It was applying all the knowledge that I learned in my nursing and prerequisites courses and implementing them into an actual clinical setting. So, working with the patients in the hospital.
So yeah, with your clinical courses, because I actually know nothing about like the layout of a clinical course for nursing. You're working. Are you like assigned a nurse, kind of like when you were a candy striper and you're assisting them, or are you assigned a patient? How does that layout work?
So, starting off, you would shadow, kind of get a feel for what nurses do in the inpatient setting, so in the hospital. And then, slowly but surely, you would take on a patient or two and start with vital signs, then assessments from head to toe, to medications, from oral medications to injections to IV medications. And from there, you would just keep doing a little bit more and more and more until your final senior year when you do your senior practicum, whereas you get to specialize in your specialty of choice and you basically get to work until you're a primary nurse. So you do anywhere from 100 to 300 hours. It's dependent on the institution. And you learn basically how to be a nurse in that specialty. And it's the one of the best experiences.
So you picked pediatric oncology because you felt like it was probably going to be the most impactful field within nursing for you. Is that right?
Yes, kids in pediatric oncology are so, so resilient. They really, really put life in perspective, to be frank. But not only that, just scientifically, the biology of cancer is so interesting. And at the institution that I work at currently at UCSF, we get to do top tier, newly FDA approved medications and biotherapies that are phenomenal. And they really are life changing. And it's amazing to be a part of that.
So this, you kind of answered my next question here, but I think it also leads into it perfectly. If you had to pick out some of your favorite aspects of your role, what would they be?
It would be the main one is letting kids go in remission, having them ring that bell and say, yes, I went through hell and back to go through this cancer treatment, but I am free of it. And now I can really live life. And so that's always the best feeling to know that you were part of this child's hardest part of their life, but also get to see them grow. And in fact, last week we had a patient who came in and they were our patient 10 years ago. And here they are in college at Stanford, actually pursuing an advanced degree, which is crazy. It's awesome. These kids really, really, really make a difference themselves. But I would say that that's the best part is just knowing that the kids are being able to fulfill their lives after such a treacherous experience.
Yeah, wow. That is seriously one of the most uh, like impactful roles I've ever heard of, like working in childhood. I mean, you already know how I feel about what you do and how amazing I think it is. But it's just like when you say stories like that, it's just eye opening. It's a really beautiful job that you have. Um, what would what would you change about your current industry? Like, what would you change about nursing as a whole? Is there anything that you've noticed that you'd want to be done differently?
Definitely. I would say I'm not complaining because Bay Area pay is great. However, I think nurses, like teachers and other professions, they do so much that we deserve to be paid a lot more. I think being in the healthcare profession and especially in nursing, not only are we using our minds and our bodies, but also just like it's a deterrent on our mental health. So there's just a lot of aspects with this job, and I feel like pay could definitely be better. And that's more so for other states than California, but just speaking for all of nursing.
Yeah, one thing that's really fascinating, but also I would say very intense about what you do is the compartmentalization that you have to practice every day when you get off of work, because you're seeing things and you're experiencing things that are some of the hardest parts of life, and you're doing this on a daily basis. Are there ways that you've learned? I think this is maybe important for young nurses out there or people looking to get into nursing. Are there things that you've learned over time that have helped you be able to sort of compartmentalize what you do when you finally do get off of work?
Yes, everyone's different. And being in pediatric oncology, we do see a lot of deaths and happen to be the hospice nurse. I think people think that in our specialty that we have specific nurses carrying on the hospice and end of life care, but in fact, we're the ones that are bagging them. We're the ones that take them to the morgue, unfortunately. Having said that, after a shift, I think it's healthy to kind of regroup and feel all the feelings that you're feeling. But then from there, the one thing that I always think about is it's not my tears to share. I'm not that child's parent. I'm not that child's sibling. And all I want to do is be strong and be the best nurse that I can be and allow them to feel those feelings and me feel, if anything, happiness that I was able to give them the best end of life that they could have had.
So, what do you feel like is the future for nursing in the sense of employment? What I always hear about is we always need more nurses, we always need more doctors. So, it seems like there's this abundance of demand for nurses. How has it felt for you? Has it been sort of easy finding roles? And do you think those roles are expanding and there's going to be a lot of future employment for nurses?
I think there's always going to be demand for nurses, just like there is going to be a demand for a lot of other professions. And in fact, I just read an article that a lot of studies are projecting the nursing shortage, because there is a nursing shortage right now, to be 100,000 to 250,000 nurses that we are going to come short in inpatient settings starting 2023. And that number is only going to increase. So we do need to entice our nurses with financial pay or other sorts of benefits. And like I said, they are fabulous. However, we need to really do whatever we can so that nurses feel supported and want to pursue this career because no matter what happens, if we have robots, they will never take away the compassion, empathy that nurses provide.
Absolutely. Like seriously, more than any role I can think of in the medical field, especially, it's like, I feel like AI's role is going to only be in the sense of like improving the efficiency of procedures, maybe. But as far as like, I don't know, I feel like the medical field is the most human to human role you can play in our society. You have to have, an emotional discretion involved, a human emotional discretion involved. Okay, so after you finished at USF, what was your first role out of college?
My first role was actually taking a clinical nurse one or new grad nurse position at Seattle Children's Hospital in Seattle, Washington.
And was that in pediatric oncology?
Correct. I worked on their cancer care unit, and throughout my career, I've been a nurse for, wow, over 5 years. And I have always pursued pediatric oncology, and I don't plan on changing that for the rest of my life.
And what was your experience like in Seattle versus now where you're working in San Francisco? What were the differences? What did you like more? What did you like less? Or what was that experience like?
I think working at two amazing institutions, both Seattle Children's and UCSF, they both offered the same amount of I guess, exposure to the different treatments and new FDA approved medications. So I was always being able to transfuse NK cells, participate in CAR T cells, so these amazing immunotherapies and biotherapies that we're able to provide for our patients. And in that aspect, I think both were amazing. I think there are some like nursing differences in terms of protocols, policies, but also like hand hygiene. At Seattle Children's, we were using gloves for everything. And then at UCSF, we did a 2-minute scrub before a shift and then just used gloves for certain central line care. So just there were minor differences, but I'd say between those two institutions, for the most part, they were both amazing. I had the best experience and I have nothing bad to say about either.
So I'm not sure if you have had experience with this, but I do hear this get brought up a lot when it comes to people asking questions about nursing, and that is the idea or practice of traveling nurses. Do you know much about like the experience of a traveling nurse? Have you? I know you've moved and worked at two separate institutions, but have you done any travel nursing? And for people that maybe that you've met that have done it, can you talk a little bit about maybe how their experience was?
Definitely. So, as a travel nurse, the biggest perk is the money because there's a stipend for living expenses, food expenses, and then on top of that, you get a standard wage that is different from the nurses that are actually a part of that institution. Having said that, there are some legality points in terms of you can only stay at an institution or in state for up to a year, then you have to switch around. And part of jumping around to different institutions is you get to see a lot of different things, which is awesome. But at the same time, you don't have a home base. So some travel nurses find it hard to like start a new life, meet new friends, while others find thrill in that and wanting to socialize and kind of diversify their nursing.
That's really interesting. Yeah. So, do you feel like when you're doing the type of nursing you're doing, where it's not travel nursing, do you feel like you're able to really build a relationship with these patients, especially in something like pediatric oncology, where I'm assuming the stays are longer than maybe some other patients? Do you feel like you're really getting to know your patients on a personal level?
Most definitely. I am able to work with kids anywhere from a newborn to up to 28 if it's a childhood cancer. And with that being said, no matter where they are in the developmental spectrum or age, I am able to make an impact as a nurse who has been there for a very long time and basically being the primary nurse throughout their treatment. It's always nice to see a friendly face, especially during COVID when you have a lot of nurses with masks. It's at least nice to identify eyes or glasses or little things like that because they don't get exposure outside of the hospital. And a lot of the kids that are inpatient in pediatric oncology are there short term sometimes, but for the most part, it's ongoing therapy. So they could be there if they are post transplant for up to like 6 months, which is a very long time, if not longer.
Wow, this is a more specific question. So, when you say you work in pediatric oncology, does that cover all cancers in general for children within a certain age range, or is it a specific type of cancer that you work with?
Yes. So there is what we call the childhood cancers. And those fall under anyone, like I said, from newborn to 28. And even if you're an adult, if you have what we identify as a childhood cancer, you will be treated under a pediatric protocol. So, having said that, the most common childhood cancer is acute lymphoblastic leukemia, also known as ALL. There are also AML, APL, and a lot of different forms of cancers, both liquid, meaning blood cancers, to solid tumors like a neuroblastoma or a brain tumor, for instance, like a glioma. There is a great I'd say range in terms of what cancers we see, but for the most part, it's ALL. And being in this profession for so long, we also kind of identify okay, between this age, usually between 3 to 5, those are the most common patients who have neuroblastoma or ALL. There's a vary in ages, but we know that males are more prone to this leukemia. Having said that, we are able to see a lot of different patients from a lot of different cultures. But the thing about cancer is that I know I'm going off a tangent, but there's environmental factors, genetic factors. There's so many things that contribute to why someone gets cancer, and that's still being explored today. But in terms of what I see almost every cancer that falls under a pediatric protocol.
Nurse who's so experienced in pediatric oncology, but more specifically oncology in general, do you have any type of preventative advice for like the general public as far as like tests that they should be getting or things that we can do to just prevent the spread of cancer in general?
Yeah, I think the biggest thing is, like I said, there are so many factors that contribute, both environmental and genetic, to a lot of different things that can contribute to why someone has cancer. There is no one reason. But having said that, if you do have any symptom that you were unaware of the origin and you need it to be tended to, I recommend going to your provider, letting them know your symptoms, and just making sure you're doing everything that you can. Especially during COVID, we have had a delay in diagnosis, and they end up being, instead of stage one, stage two, stage three, because they delayed seeing a provider. So I would say my best advice is to, if you have a symptom, see your provider. Also, environmentally, like everyone says, don't smoke, don't do drugs, avoid pollution. Like I said, there's so many things that can contribute, but just use your best judgment and take it from there.
Okay, so maybe this isn't a part of your role, but do you ever come across patients who can't afford cancer treatment? And in those sort of cases, as a nurse, what role do you play in that process?
So, nurses are the bedside number one partner and pal throughout their cancer treatment. However, there's a lot of interprofessional collaboration, and social work definitely takes on the financial aspect in terms of whether or not they can um, provide financial assistance for their care. UCSF, the institution that I currently work at, is a not for profit educational institution, and there are a lot of funds supporting patients like immigrants or other uh, Medicaid members that can't afford treatment, such as chemotherapy, radiation, or a transplant. And we have a lot of opportunities to basically give them all the care they need and have it paid for. And that is government run. On the other hand, we do have some wealthier patients that actually do come from abroad, and they will pay a tremendous amount, like greater than 500,000 to like millions of dollars. And they'll pay for the highest standard of care that UCSF is known for.
Wow, that's really fascinating when you bring up how you work with social workers as far as when it comes to financial assistance and things of that sort. The reason it's interesting, and I want to ask more about this, is because I think it paints a larger picture, which is the very dynamic role of a nurse. You're sort of this liaison for the doctor. It sounds like you may even be a liaison for the social workers at times. Specifically, what is your role with the doctor, and what is the doctor nurse relationship like when caring for a patient?
So the doctors are the diagnosers, the prescribers, and the brains of the operation per se. Having said that, the nurses are the ones that implement all those interventions. They are the ones giving all the medications. They are the ones monitoring and assessing and taking those vital signs. But at the end of the day, the doctor nurse relationship, it's a partnership, because a lot of the times the doctors that are on overnight when I am doing night shift are residents, so they're newer doctors. Having said that, they are so professional and really respectful and ask for our perspectives, because sometimes the nurses will be working there for 10, 20, 30 years and have so much experience that they already can anticipate this is the order that we need. Patient has an infection, like, I am in school to become a nurse practitioner, so I already have that provider mindset. But that aside, working in this field for so long, I know a kid has an infection, we need Tylenol, we need cefepime, we need all these different things. in order to treat this patient and get them to a hemodynamically stable point.
Now that you are where you are, you've had success in the industry, what would you say to a young aspiring nurse or somebody interested in nursing if they were wanting to do exactly what you're doing now? They wanted to be in pediatric oncology and working as a nurse.
New nurse or mentee wanted to pursue pediatric oncology, I think my best advice would be for them to truly think about the mental strain that's going to come with this specific specialty. To know that they want to work with kids because that's very important. Adult and pediatric nursing, though have a lot of similarities, are very different. And three, um, have the heart of the pure heart filled with empathy and compassion, and make sure that they're willing to give everything that they have, not only knowledge wise but also like from the heart, because that's truly important and what makes a great nurse, and I think especially when it comes to pediatric oncology.
I think that's great advice. It's like you have to have a natural level of empathy and compassion to get into nursing, especially to get into nursing when you're working with children. I was lucky enough to have a little bit of experience working with children in the past, and it does take a special amount of patience and a special amount of care. So you know how absolutely proud I am of you and how happy I am to call you my friend in terms of a lot of things, but especially in when it comes to what you do as a professional. I'm so excited for you and all your success that you've had thus far. I always start the podcast with the question, so what do you do? And I always end it the same way as well. And so my last question for you is, so what will you do next?
So, I am actually currently in a master's program to become a acute care pediatric nurse practitioner. So, I am hoping to pursue an NP position in pediatric oncology or BMT, bone marrow transplant, inpatient. I want to be part of the treatment plans. I want to be that provider that is providing all the knowledge and being that brains of the operation. And I'm currently, like I said, in that program at UCSF, hoping to get that MP job. And who knows, maybe I'll be back in school for my doctorate. I love school, so I wouldn't be surprised if I was back in school.
Well, Brianna, I know how successful you've been as a medical student, as a nurse, and I know you're going to have that same amount of success and impact on the world as a nurse practitioner. So thank you so much for your time. I really appreciate it. I know how busy you are. We loved having you as the fourth guest on our episode today, and I wish you nothing but the most success in your career.